Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided all the topics which is covered so far in a systematic order. Now we are talking about autism and as well as Ayurveda. In the last class, we are discussing about some of the core symptoms like social problems, communication problem, etc. And there is a lack of eye contact, etc. Now, another important symptom which is seen in case of autism is restricted and repetitive behavior. Child is showing a restrictive behavior and child is also showing a repetitive behavior. Restricted means something withdrawn, whereas repetitive means continuously doing the same thing or sameness. As we know, a child of autism is totally cut off from the external world, so he will be bored as he cannot communicate. This is the main problem we have to understand. See, whenever we are not able to appreciate any of the things which is told by the outsiders, we are not able to appreciate the sensations of hearing, sensations of visuality, etc. And we don't have any input from the external world. So when such things go on continue, so child will be bored because he is not receiving any new knowledge from the outside. So he will be bored as he cannot communicate with the external world. So he does the repetitive movement to express his feelings. These repetitive movements which is doing, it may be tapping of the hand, or it may be beating, or it may be touching something. So these are actually the way of communication that he used to express his feeling. Okay, so he does not so therefore he does the repetitive movement to express his feelings. So maybe scribbling or maybe causing pain to himself, this may be, or sometimes tapping, or sometimes laughing, sometimes kissing the hand. So such same things he will do repeatedly. So this repetitive nature is or behavior is one of the major symptom of autism. So he is restricted and he will not listen to your command. Now that's a restriction. Another term to use is restriction. Restriction and repetition. Restriction means he is not totally restricted and he will not listen to your command because he is not getting that sensory input at all. So there is no question of following your command. So he only knows to do that. He keep on doing that. Therefore, he keep on doing the same thing which he is very comfortable and he knows. Okay, so this type of movement which is continuously doing, mimicking the sameness, okay, sameness, they are called as stereotyped motor movement or speech. Okay, so speech is also actually muscular movement because of muscular movement. So he can have a stereotyped motor movements like tapping of the hand, touching the hands, or fisting of the hands, etc. Okay, similar movements will be seen. Now, it may be any kind of movement. It can be any kind of movement, any kind of motor movement. So he may go on repeating the same things maybe 100 times in the episode, maybe up to 100 times he can do that. Why this sameness occur, repetitive nature occur, or stereotyped motor movement occur? So that is because of this problem where he is not able to communicate with the external world. He will be bored and he find out his own way of expression of his feeling as he is cut off from the external world. And there will be insistence on the sameness as his world is limited. Now the child will show the same thing. Suppose his child is always comfortable sitting in one red color chair, so always he'll go and sit there only. He want to watch particular cartoon of the TV, always he watch the same cartoon, or he want to wear the same dress, or he may be doing the same type of movement. So this type of sameness will be there, the insistence for this sameness. Why? Because his world is now very limited. Okay, as there is no any external things are coming as an input to his mind, so his word is now very limited, so he will comfortable with what he is able to do. So that thing he will do it repeatedly and always he will do the same thing. Okay, there is also restricted interest. Okay, because see, you just understand, there is no sensory input at all. So what this child is doing is without any sensory input, he is doing by his own. If somebody call my name, what is your name, then I can answer. But I am not getting what you are telling. Okay, So no any communication, no any touch communication, no any visual communication, no any auditory communication or any type of communication, then my world is very limited. Okay, so I will go on doing the same thing what actually I am comfortable and what I actually want to know without any sensory input. Okay, so hypo and hyper reactivity to the sensory input, he expresses the emotion in excess or loss. Actually, in case of autism, most of the time there is a hyposensory stimulation, or sometimes there may be hyper sensory input also because of a failure of modulating these sensations which is received. So there may be sometimes hyper. So therefore, so emotions may be either excess or sometimes it is less. So therefore, sometimes child is showing excess emotional disturbances, or sometimes there is no emotions at all. Okay, so these are the very important core symptoms. So we have seen the social problems, communication problem, and restricted and repetitive behavior, and all these things are the core symptoms of autism. Now apart from that, there are some other common comorbid medical illness. Okay, comorbid medical illness may be there, and some underlying primary disorders may be also cause for this autism, like genetic disorders. Some of the genetic disorders involve errors of metabolism or some metabolic and environmental related genetic problems. So they may also lead to autism because of underlying neurological problem. There may be psychological illness. So these are all actually the important core symptoms and other comorbidities or associated symptoms along with the autism. So this is all for today. In the next class, again, we will meet with another part. Thank you very much.